Back now on Triad Today, and I'm very excited to meet this guest. He has an office in Winston-Salem, and J. Paul, director, if we can meet Dr. Laurence Cane. He's a podiatrist by trade. I'm a talker by trade, so you can see which one has the more important job, him or me. He is with Mothershed, Arne Cane, a cornerstone healthcare practice. Dr. Laurence Cane, thanks so much for coming.
Thank you for having me.
I really like the work you all do, and that's people sometimes don't understand exactly what a podiatrist does. We didn't rehearse this, but give me like 10 seconds on that.
Well, podiatrists treat medically and surgically foot and ankle ailments, and we also dispense certain types of shoes and inserts that help people walk.
Boy, that's a big thing. We're going to get into that in just a minute, but let's talk about diabetes for a second. How can diabetes affect feet and ankles?
Well, diabetes can affect the foot and ankle in two specific ways. One is development of neuropathy, which is a numbness that occurs to the feet over the course of time, and there's also something called peripheral vascular disease, where the diabetes can affect the circulation that goes to the feet. And this can be problematic with patients with diabetes, because if they get an infection or have hammer toes and bunions that rub in the shoe, get cracks in the skin, you can get an infection that may be difficult to heal. So it's very concerning.
Let's talk about different types of pain. For example, a lot of people I've talked to will complain and say, hey, I have this pain in the ball of my foot. What is that?
Well, the pain in the ball of the foot could be a few things. One of the most common is a bursitis capsulitis at what we call the metatarsal head, and people put a lot of pressure there, and it becomes inflamed and angry, especially when you buy new shoes or start a new activity.
Right. What do you do to correct something like that? I mean, is it genetic? Is it just going to happen? Is it because you get new shoes? Can you take medicine for it, or what happens?
Yes, it's actually all of the above. You can take a medicine for it. Sometimes an injection therapy can help. Altering shoes and getting some custom or non-custom inserts may be able to help you to relieve some of that pain.
It's amazing what you guys do. I'm fascinated, because sometimes just with a simple insert of a shoe or something, you can change somebody's life. I don't mean to be doing a commercial for you, but I mean, I just think it's just cool stuff, because I've had family members that have gone through that. Hey, what does it mean if somebody says that their ankle feels like it's just giving out?
Well, oftentimes when I hear that complaint is something called chronic ankle instability, and what that means is the ankle ligaments are kind of lax or loose, and what happens is when we go to walk, we feel like the ankle rolls out, and that can be a result of a traumatic injury or just a hereditary trait where you just have loose ankles.
Right.
And this can be problematic if you're trying to do sports or something like that, because you can severely twist your ankle out.
Yeah.
So we try to watch for that, and it's really, you learn from history, the patient's history, so on and so forth, of how often that happens. So it can be quite concerning.
Yeah, does it make any difference whether you wear high tops or different tops? I mean, you hear kids asking this all the time and say, well, I want to wear high tops, or I want to wear the low thing. Does it really matter? I mean, if you've got a problem with an ankle, or if you've severely about to sprain it, a little bit of canvas isn't going to make a difference, is it?
Well, it can. I mean, in terms of high tops, it depends the activity or sports you're playing. If you're playing basketball or a lot of leaping jumps, you're going to want to wear high tops to stabilize the ankle for when you land. You don't want to land incorrectly.
So it does stabilize. Okay, good. I was wrong. What causes heel pain? That's another one I want to ask.
That's probably the most common complaint that comes to our office, is a heel pain, and most common is plantar fasciitis, which is the ligament that essentially connects the heel of the foot to the ball of the foot. And when the foot rolls out, it tends to flatten out, and to put strain along this ligament, it becomes inflamed. There are many causes of heel pain, but the most common predominantly is plantar fasciitis.
What about flat feet? Here's a common thing that you read about on the internet a lot. But if, let's say, not just for myself, but let's say if my child had flat feet at a young age, is that something to be concerned about, or what can you do about it?
Well, what's concerning with children with flat feet is when it comes to playing sports or activities, they may not want to play it because it can be painful. They may be prone to injury. They may get pains and sores in their calf. They may get it in their heel. And then you can also twist your ankle.
Sure.
Quite frequently. So with children, they're
I didn't realize that. So you're more prone to, well, that's why I messed up my ankles as a kid. Because see, if I'd had you,
that's right.
Why are you so young? If you'd been around when I was younger, you could have helped me. Well, so that's not your fault for being young.
Exactly.
Isn't that terrible? He's on my show as a guest, and I'm criticizing him for his age. All right, now, here's the website. I don't want to lose time on this. CornerstoneHealth.com. We've got lots of information on there. Dr. Laurence Cane in Winston-Salem, go see him. Great guy. Thanks for visiting. Will you come back?
I will.
All right.
Thank you so much.
Be older when you come back.
I'll try.
We'll be right back.